My name's Katie, and I'm a liver transplant coordinator here at the Royal Free Hospital in London. I help people through having a transplant every day, and I know it can be a confusing and scary time. The first step is having an assessment to decide if a liver transplant is the best option for you. You'll have tests, scans, and conversations with the multidisciplinary team. They need to answer 4 questions. 1. How serious is your liver disease? Do you need to have a liver transplant? And if so, how soon? 2. Are you physically fit enough to have the transplant and to recover well afterwards? 3. What is the anatomy of your liver like? Is there anything that will increase the risk of your surgery? And 4. What is your life situation and how can the transplant team support you after your transplant to help you stick to medical advice and keep yourself and your new liver healthy? This video will explain what happens to help you prepare and know what to expect. Our volunteer Sarah will demonstrate having some of the tests. There are 7 different transplant centres in the UK and the process is a little bit different at each of them. This video gives a general picture. If you aren't sure what happens at your centre, ask your transplant coordinator. Either during or before your assessment, you'll have an education session to tell you more about the transplant process itself, including the risks, and about life after transplant and the things you'll need to do, like taking daily medicines. This might be online or it might be in person in a small group. If possible, bring a member of your family along. This is a really good opportunity to ask questions and meet other people in a similar situation. For most people, the assessment takes between 1 and 5 days. You'll usually be an outpatient, meaning you won't stay overnight in the hospital. Your transplant coordinator can tell you about the arrangements for your assessment. Ask them any questions you have. Some common questions include, where will I stay overnight? Can I bring a family member to my appointments or have visitors? What happens if I need to have a carer to support me? Will an interpreter be available or can I bring someone I know who speaks English? Can I take my medicines as usual before my tests? Do I need to be nil by mouth before any of them? And is there Wi-Fi I can use in the hospital? Bring whatever will help you to stay comfortable and relaxed, or at least distracted. Some good tips for things to bring include comfortable clothes which you can remove easily and pull up for tests, your current medicines and a list of all the medicines you take, test results and doctor's letters about your condition, any letters you have from the transplant centre, a bottle of water, a notebook and pen for you to write instructions and questions in, a phone and a charger, one with a very long lead is best, books, magazines or puzzles. You will have a range of tests to check how serious your liver disease is and whether a transplant is the best treatment option for you. These tests also help your team understand how urgently you need a transplant. As well as tests, you'll speak to a liver specialist called a hepatologist and to a transplant surgeon. These tests are usually ones you've had before and you'll be familiar with. They are blood tests, a CT scan or an MRI scan, and sometimes a biopsy. Different people will have a different combination of tests. Your coordinator will tell you which tests you will have. A liver transplant is a major operation and it has a big impact on your whole body. Your assessment will check your overall health and that you're physically fit enough to cope with the transplant and recover well. You will also have a conversation with a transplant anaesthetist. This video tells you about the common tests that most people have. Different centres will do slightly different tests, and you might need extra checks, for example if you have or are at high risk of heart disease. Your coordinator can tell you which tests you will have. You'll have tests to check that your heart and lungs are healthy, such as an ECG, an echo, a chest x-ray, and spirometry. Your team will want to know how physically fit you are and how well your heart copes when it has to work hard, like during the operation. Different centres test this in different ways. For example, you might be asked to cycle on an exercise bike, walk on the treadmill, or climb the stairs. The Liver Frailty Index is a commonly used tool. It's a good idea to practice while you're waiting for your assessment by doing some physical activity every day. In some cases, you might do the fitness test while having your heart monitored, for example with an echo. Ask your coordinator beforehand how this will work for you. Whatever the cause of your liver disease, you will have a holistic assessment of your whole life. This is so that the transplant team know how they can support you and give you the best outcome possible. You will talk to a range of people, including your transplant coordinator, perhaps a social worker, an addictions nurse, and a psychologist.
Hello, my name is Nuala. I'm the clinical nurse specialist on the liver transplant team at the Royal Free. My job on the team is to see all patients who get referred for liver transplant who might have a history of any alcohol, substance misuse, social, domestic, mental health issues. So quite often patients might say that they feel uncomfortable talking about alcohol history and that they didn't drink very much, or that it might have just been in the evenings or at weekends. So part of this process is important to share with us all of your history so that we will be able to get you through the treatment process. The reason why we ask sometimes quite difficult questions is because there might be psychological reasons why people drink, and this is also something we can really support and help with, which might not be so easy to access in a community.
While you're waiting for your transplant assessment, there are lots of things you can do to give yourself the best possible chance.
My name is Emma and I'm one of the liver transplant dietitians at the Royal Free Hospital in London. My role is to assess your nutritional status and provide advice to help improve your quality of life and maximise your nutrition ahead of a potential liver transplant. As part of your assessment, we will measure your weight and height as well as measurements of your muscle mass. This is done by measuring your upper arm right up to your shoulder and measuring your grip strength. At your assessment, a dietitian will sit down with you and complete a detailed diet history. This may take up to an hour or even more. We are trying to assess your food choices, your meal patterns, and how much you're able to eat. We're not here to judge you, so please don't worry about good and bad foods. Please be as honest and as detailed as possible, as this can help guide us to help you maximise your diet.
My name is Abby and I'm a transplant physiotherapist working at the Royal Free Hospital. When you come for an assessment, one of the things we will be looking at is your fitness for surgery and how well you'll be able to recover afterwards. We need to make sure that you are fit enough to make it through the operation and that afterwards you'll be able to get up and about as quickly as possible to prevent any post-operative complications such as chest infections. In the lead up to your assessment, there are a few things you can do to prepare for this. To improve your fitness, you want to think about doing some daily moderate activity. Moderate activity is anything that gets your heart beating faster, it makes you feel slightly out of breath and a bit warmer. Try to make it something you enjoy, as that way it is easier to keep motivated. Remember, it's best to build up slowly, even if that means starting with only 5 minutes a day. The only person you're in competition with is yourself.
After your assessment, the multidisciplinary team will discuss the risks and benefits of transplanting you and come to a decision. They will let you know the outcome about a week after your assessment finishes. There are 4 possible outcomes. The first is that you won't be listed for transplant. You should be offered a second opinion at another centre if this is the decision for you. The second is that it's too early for a transplant. A different treatment is better for you right now. The third is that more investigations are needed. This is common and these tests will be arranged as quickly as possible. The fourth is that you will be listed for a transplant. If you agree, you'll be put on the waiting list for a new liver. Whatever the outcome, your coordinator should explain why this decision has been made. They can also answer any questions that you have and advise you on the next steps. The British Liver Trust provide information and support to help you, whatever the decision. This includes support groups, a nurse-led helpline, and plenty of information and advice. Visit the website to find out more.